we have about an hour to report back from the discussions within each breakout room, and then we'll spend some time after people report back to have a larger discussion. So I think what we can do now is just go breakout room by breakout room, and the facilitator of that room, or whoever you've designated to be the reporting back person, ideally the facilitator, can just share with maybe maximum 5 minutes of the, condense the discussion as much as possible, putting an eye on what might be the next steps that we could take to move that specific theme or topic forward, actionable stuff if possible. So how about we start with Dr. David Levy, Tobacco Regulatory Science Priorities and Modeling. Could you please report back to the group?
We had a really great discussion, and it kind of ended abruptly because going back to the larger group. But let me try to capture what was said in a little bit different order than the way it was presented, but hopefully captures the essence of our discussion. First, it was emphasized that we need to really focus on thinking about the harms in a more systematic way. And what's meant by that is, we all kind of agree that cigarettes are important, but we really need to think about the other products and how the relative harms of those products compare. And it's difficult in the current environment because there is such a controversy, and that's why it's one of the most wicked challenges that we face. Then we also talked about the need to, not only do we need to think about the aggregate of products in terms of harms, but also what are the relevant products. And we need to do that both in terms of the individual products themselves and also the overlapping use of products. And this becomes difficult because, we need to, from a public health standpoint, we think about the harms, but in determining what leads to those harms, to what extent and how do we incorporate the relevant transitions in products. That led us to the question of what data source, how do we combine different data sources? And lots of the discussion in the last couple of days was about the different surveys and how they have different results. We talked about there's not only the surveys out there, but we need to think about, the major surveys, but we need to think about the other sources of information, such as information that's collected in a sense in a more rapid way over the internet. In addition to that, the kind of information from market data, sales data, a topic that really hasn't been brought up very much, but that gives us a real way of capturing the most recent changes in use patterns. And then related to that, then how do we integrate that with some of the methods that were discussed, such as the discrete choice analysis, experimental marketplace, and so on. And then finally, how do we make sure that the different ways in which we're modeling things responds most directly to what's needed? In other words, how do we, as a CAsToR, much of our work is related to the FDA, but how do we come up with ways of ensuring that what we're doing is consistent with the needs of that stakeholder, and how do we consider how the modeling is relevant to other stakeholders? So hopefully that captures our discussion. Thank you.
Great. Thank you, David. I think that was excellent and very precise in summarizing the points. How about we move on to the next group led by David Mendez, who was leading the breakout session on training of junior investigators in modeling. David, could you please report back maybe 3 to 5 points that were key that came up during the discussion?
Yes, we have an interesting discussion about what's needed in the field of tobacco modeling. And, there are several things that came up out of the discussion. One is that everyone, we need more formal training into what we call system thinking. So try to conceptualize either modelers or non-modelers, try to understand a problem in terms of inputs, outputs, processes inside, how they are interconnected. So have a global view of the process that you are trying to replicate. And that there's formal training for that. That will make much easier the communication with a person who have this idea and the person that is going to implement your that idea, like code or design propose a formal model to investigate what you think. So system thinking is important and can be acquired. But we also discuss the need to get more individuals that have formal training in modeling or math, system science, etc. So they can be they have the overview of the consistency of the machinery that you're putting together when we are defining models. So someone that can see the project and understand what's needed, but it can say, I can do this in many different ways, but I chose this not because this is the only thing I know to do, but it's the most effective, right? It's going to be the most efficient. It will give me the range of answers that I'm looking for with the least effort. So I don't need to go and have a very descriptive picture of what I'm trying to model if it's not going to help me to answer the question. Someone who can have also the idea of what the pitfalls of that machinery has. So what behavior you are preventing, right? For example, we know we are using linear models to predict project prevalence and effect of policies, and we have been doing that for some time because for a while they predicted very well, right? But the prevalence in smoking is approaching is decreasing. So when you decrease, linear models will never tell you that it's going to reach zero, right? So it's going to be just approaching zero, and then zero is going to be an asymptote, and you'll never get there. So when is it the time to abandon the models that work so well in the past because the process were linear to reflect the new realities of the and we need more people with expertise in that kind of understand the behavior of the models that they are putting together. And having said that, everybody agrees that we, in the modeling, community, it'll be ideal for those kind of individuals to have an extra training in tobacco modeling or tobacco expertise, and have an extra training in the health system in the US, for example. What is the possibility of regulation in the US? To have also, other disciplines that we can put a lot of ideas and a lot of theory behind the modeling approaches and the choice of connections that you have, like social scientists, behavioral economists, individuals that are trained in, have a framework for, how people react. So that be to certain stimulus. So that is also an important part to add to a team. So we also agree that if you want to have a modeler, a person that understand the machinery, is better to have a person with a formal quantitative training in the undergrad or grad, and then get them the tobacco and the social, part science of the expertise, so that person can communicate with other people in the team. What? But again, the training in system thinking, it should be, expanded, to cover, most of, all people that are working in this area, modelers or not modelers, to have a way to transmit ideas that can be, can be understood for other people, and out of that, there's a subset of individuals who can put the engine together behind that system thinking approach. What are the next step? It's difficult, but I think we need to start defining, those roles, and look for where individuals are coming from, are trained. What are the schools that are putting individuals with the characteristics that we want, and what complementary, training or or enhancement we can give to those people, and to get them to the expertise that we need.
Great, thank you very much, David. Great, we'll move on to the next breakout room. But before that, I just want to remind folks, if you have a question, please, you can chat it into the chat function to Q&A, and we'll keep track of it. And then we have a larger discussion, we can call upon you to carry the discussion forward. Or even if you have just some points that you would like to make some comments, you can record them in the chat function now to Q&A, okay? Or later raise your hand as well. Sorry, go ahead, Rafael.
Yes, thank you, Ritesh. I'm happy to report for our group, and anyone feel free to chime in if I miss something. I think there were three main topics. One is this was about the timely translation of modeling results to support the regulatory process, and one was, I guess, we started around the relationship between the regulator or decision makers and the modelers, and how that might plays a role in how that translation might happen. We reflected on what Rocky Fire presented earlier, and how CISNET has had experiences collaborating with decision makers, and how the nature of the regulatory process, the tobacco regulatory process, and how FDA needs maybe or cannot necessarily tell a modeler, we need to know this now. or be very directive or prescriptive because of I guess organizational or maybe legal and other type of considerations. That is different, right? And that needs to be acknowledged. There was recognition that through the CAsToR program, for instance, our center, which focuses on modeling, has direct participation of federal partners, both at NIH and FDA, and that through those collaborations, there is direct, I guess, input from the at least members of the FDA, CTP, and NIH. So that's an important aspect that is unique. And but I think we're also thinking more broadly, right? Not only for our center but just in general, right? About modelers in tobacco who might be doing work that is important. I think there were maybe let me think if there's anything else that could be brought up in there. I think, well, one thing that was brought up, and is of course through other ways that, and this is within the discussion of what are facilitators or barriers for that rapid dissemination, that of course were direct collaborations with modelers, with other tobacco researchers, particularly those collecting data, can be good in order to facilitate the I guess the process by providing modelers with rapid access to data as it's being collected, and that from the, I guess, regulatory or funders perspective, adding that or in RFAs or in general programs highlight that these collaborations are possible, even welcome or encouraged, could facilitate the development of joint projects that make that process faster. I think within this also kind of segues into the second topic, which is maybe the second, which is data. And then we talked a lot about that, and David Levy in the report, it seems they were also talking about it in that group, where of course the availability or the possibility of getting data in a timely manner is critical for the modelers and be able to, I guess, develop their models using the most recent and relevant information, and that there are a lot of barriers out there. For instance, PATH being probably the best data source, and the lack between collection and publication or release of that data, of course, is a challenge. There are other data sources that maybe come out more rapidly, but also with delays, like national cross-sectional surveys. So then I think there is needs for innovation in order to facilitate the acquisition of data in a much rapid way, including, for instance, what David mentioned, David Levy, the use of other sources like sales data, marketing data, tax data, and other information that haven't necessarily been used and that could be served as a great source of timely information. What we discussed in the session yesterday in terms of these approaches to, for instance, get estimates or bounds of what the effects of policies might be, and as well, and then related to the previous comment, direct collaboration between modelers and people who are collecting this data, so that the information could be used as it's collected. And so that's where fostering direct collaborations between modelers and non-modelers, or modelers and data collectors, could be a great way of improving this area. The last point I highlight, it was about publications and dissemination, and we did talk quite a bit about the use of preprints and other approaches for more rapid dissemination of results. We understand, and it was very clear day one, that publication, peer review publication is the the goal and what we should all be aiming for, but that also, I guess, it's recognized that preprints are having a role and will be having an increasing role in public health, and they could have in tobacco control, of course, and particularly to help disseminate modeling results in a more rapid fashion. We had discussion about what is the perspective of FDA, or what might be the perspective of FDA and NIH, or you and other decision makers, of using information from preprints to support their decisions, and that seems to be coming. And then the last, maybe I think just to conclude is the point that through the pandemic, COVID-19 has been a great example to show how some modelers were able to very rapidly disseminate results and findings through preprints, through websites, through releases in GitHub and other ways, and data visualization, and that should probably be embraced and developed. So I'll stop there.
Great. Thank you very much, Rafael. That was a very thorough report back, and really exciting stuff coming up from each of the breakout rooms. I think next we will do, I think Jamie was next. Jamie, are you back? Yes, you are, right? Yes. Yeah, so please report back from your breakout room.
Absolutely. Can you see me?
We see you, yes.
Great. So we had a really interesting conversation around basically model sharing and collaboration, accessibility, transparency, all of those kinds of topics. And the questions we asked were, how could we strengthen interdisciplinary collaboration in tobacco simulation modeling? How could we incentivize researchers to share models and work collaboratively to improve them? How might we develop structures that facilitate model verification and reproducibility? And then how might we encourage the creation and maintenance of a repository of models with standardized documentation? And one thing that we and these questions are all really related to each other. As for the interdisciplinary collaboration, one idea that was discussed as a group was really thinking about what specific needs are in modeling. And I think we talked a bit about this in the symposium around input parameters that are needed, network-based data needs, information that currently is not available to tobacco simulation models because that data has not been generated, has not been surveyed. And if we can be explicit about what it is that's needed, then we can kind of start forming collaborations with people who could be part of acquiring that kind of data, and therefore invite other researchers to be involved. So some of this is about bringing non-modelers into the conversation around modeling so that they know what types of information are most useful. And then you might also say that it's worthwhile to have modelers in those other conversations around surveillance and other kinds of data collection systems, so that we can kind of design information in a way that is conducive to the needs of both modelers and non-modelers, and in that respect, kind of strengthen interdisciplinary collaboration. Now, as far as incentivizing researchers to share models and work collaboratively to improve them, we talked about this idea of having some kind of rotational program where someone goes directly and learns from another team or another modeler to kind of understand how that work gets done. And I think, CISNet has a similar program called the Passport program, but can something like that exist for within the sort of TCORS and CASToR network? This would basically allow researchers and visitors to learn from each other, but this would be specific to modeling. And then as far as the structures that facilitate model verification and reproducibility, I think the item that seemed to get the most traction in our group discussion was this idea of a kind of online accessible repository that is essentially a table. And I think the phrase that was used by, I'll give credit to Esther Salazar, a taxonomy of models, where each tobacco simulation model is kind of described in a very standard way. And in this table where we have input parameters, assumptions that are explicitly laid out, and then sort of other descriptive information that's very standardized, and maybe modelers could work together to determine what kinds of information needs to exist in this online repository. And now with CAsToR has similar things like a model profile on the website, so something similar to that, where you can very explicitly see how assumptions are similar or different. You can explicitly see which inputs are shared across multiple models and which inputs are not. And then within this repository, if someone wanted to go and directly look at code or directly look at inputs that are being used in the model, then they could go there and immediately kind of download them or take a look at it. So essentially, this would be a kind of website, and I think there would need to be a discussion about whether this would be a publicly accessible website or whether it would be initially an internal website for people who are included, but that this website would have model code, input parameters, and a comprehensive list of assumptions and limitations that are available for both modelers and non-modelers to look at. And that this repository would really require some labor. That is, you would kind of need to make this somebody's job to pull together the relevant information and synthesize it and standardize that information, maybe even come up with guidelines on how that information should be reported to be part of this model repository. We did think that at least the U of M Georgetown T-Course is positioned well to be an example when it comes to model accessibility and model sharing. And I think that's a good thing. If the tobacco modeling T-Course can encourage this as a practice, then we can kind of facilitate and support other modelers outside of that to do the same thing. One challenge that we talked about in terms of funding the work that would go into the development of this repository. If the funding comes directly from FDA, does that mean then that we're only considering models that are domestically focused? Or are we only then considering models that deal with policies that fall under FDA's jurisdiction? So for example, we earlier in the symposium, we've learned about the folks at Aspire who are doing work around the tobacco retailers. Now, would those kinds of models, be included in the repository, even if the funds supporting the work going into that repository are specific to the FDA? So those are some of the ideas that we came up with. But I would say that across all of them, the idea of having some kind of accessible online repository where code and data and inputs can be shared and looked at together would be a really great thing to kind of pursue more seriously going further. And I think identifying the funds and identifying the where the effort would be coming from, it would be important in terms of moving that forward. How can we make this someone's job, essentially?
Great, so many excellent ideas. This is wonderful. Thank you, Jamie, for sharing that. Again, if you have questions or comments, please just type it into the Q&A option in the chat so we can record that and then call upon you when we have a larger discussion. This will be the last report back from Cliff Douglas about engagement with industry. Go ahead, Cliff.
Okay, thank you, Ritesh. And I also want to thank our group. We had, as one might expect in this area, quite a robust and rich discussion. It's an interesting area when you think about the primary focus, which was whether those of us in the research community, and it involves modelers in academia, but of course the research community more widely, whether we should support and pursue engagement between us and industry defined in various ways, but obviously the major tobacco companies, for example, industry involved in the production and marketing of vaping products, et cetera. So we're charged with addressing three major questions. The first being, what value is added, or I suppose we could say potentially added, to the research mission by the engagement of academic researchers with industry. The second question that we looked at was how do we optimize and ensure ethically appropriate communications between modelers or researchers more broadly in academia with industry, and what safeguards in the event such engagement is pursued are needed when academic researchers interact with industry, industry researchers or other industry figures. And then of course, we also talked about action steps. So within the category of the potential value that might be added, first of all, it was recognized by all of the participants that this is a fraught area. This is the question of any type of engagement with industry has been front and center as an issue with the Society for Research on Nicotine and Tobacco, other professional societies and organizations, and many informal gatherings of many of us. The background that we looked at is the fact that industry certainly has data which may be useful in developing models and conducting research. The industry has data that is not available or necessarily available to the academic research community. It's internal. It's sometimes, if not often, regarded and treated as proprietary. And in the area of modeling, industry-related models, it was described, are few and far between, but could be useful, of course, to the larger modeling community. The industry, upon request, has been, one could say, cautiously forthcoming in sharing information, but there is, as we all, I think, appreciate, the likelihood, if not the certainty, of a certain cherry-picked nature of what is disclosed or not disclosed. The second question about optimizing ethically appropriate engagement between academia and industry, one suggestion that was made was that industry be asked to publish data openly, so it wouldn't require individual communications, but it would be accessible in some generally open and available manner, which could then be accessed and analyzed, and it would reduce the concerns around developing direct relationships with industry. It would create a more of an arm's length type of environment. Conflicts of interest always have to be kept in mind, and folks were concerned, or generally concerned in our field, about any involvement with industry producing accusations of bias, and there is, of course, always the concern, and this involved all of these questions that we were addressing, around the fact that the industry is obviously guided by the profit motive and maximizing shareholder value, and so the disclosures around this are a critical feature. When it came to the question of safeguards that are needed, one thing that was noted is different organizations or agencies actually approach this in different ways. There was discussion around the fact, for example, that NIH, NIDA, and other NIH sub-agencies do not regard the tobacco industry as a stakeholder, and this is taken into consideration with regard to funding and funder relations and these connections. The FDA, on the other hand, as guided by the Tobacco Act under the Food, Drug, and Cosmetic Act, directly regards industry as a stakeholder and has much more direct interaction for many obvious reasons that I think everyone here understands and appreciates in terms of collecting scientific information and submissions from industry in general under the statute, including at the request of the FDA, but then of course, specifically in connection with the submission of regulatory applications, PMTA, MRTP, et cetera. So the obtaining of information there may be treated quite differently from how NIH, NIDA might do so. And it was pointed out that, in fact, that there is a policy, and we can share this information that's online at drugabuse.gov that addresses how this is handled by NIDA. And so there are very specific sort of requirements and policies around that. One other observation that was made is that there's also the question of quasi-industry data sources. So these don't come directly from, say, a PMI or Imperial Tobacco, but rather are other organizations that under contract with industry, and it even goes to funding of them. For example, Nielsen are independent, regarded as independent often, but in fact are funded by industry, and so we have to take into consideration how to treat the data that are produced by those means. And the issue of cherry picking was raised there, but they're often seen as trusted sources of information, including by government. So there was a lot addressed here. In terms of action steps, we tried to keep it at a kind of 35,000 foot level. One recommendation that was made was that industry be called upon to post data publicly, as I noted earlier, so that it could be generally accessible without the need for specific arrangements being made by individual researchers or teams of researchers with industry. Given the interest of the entire membership of and the organization itself at SRNT, one suggestion was the potential for actually conducting an event or symposium around this topic to be considered in depth, given the complexities involved and, again, the fraught nature of the question of engagement between academic researchers and industry. And in general, in the sense of an action step, it was recommended that we take into account and build awareness around these types of interactions, and including in the area of how this might affect research and research funding based on the policies of the funder and the interest in avoiding any type of conflict, actual or potential. So I think that's more or less the summary of where we are, but I invite other members of the group, because of the likelihood that I may have overlooked something, to please pitch in with your follow-up on this and any elaboration or clarifications.
Excellent. Thank you so much, Cliff. That was a really thorough description of the pitfalls and the benefits of maybe engagement with industry in tobacco control.